Question number 4, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. On what date was the Ministry of Health first made aware of data manipulation of the 6-hour emergency department target by district health boards?
The Honourable Dr Jonathan
Speaker,
Coleman.
people have raised issues around the detail of the health targets on and off for 7 years. However, when I was down at the Emergency Medicine Conference in Queenstown last Monday, clinicians told me that they strongly support the 6-hour emergency department target because it's improved the quality of care right across our hospitals. And as shown by recent Auckland University research, the ED target has reduced crowding in emergency departments by 50%, but very importantly, it's literally saved 700 lives per year since its introduction, and that is a very real achievement.
Speaker.
Order. Order. Point of order,
Mr Speaker. My question was on notice and it was specific. On what date was the Ministry of Health made aware of data manipulation of the 6-hour emergency department target by district health boards? The Minister did not answer it.
I listened very carefully to the answer given, and my interpretation was the Minister is saying that that information has been coming in on a very regular basis. I think he quoted over 7 years. The way forward is I will provide the member with an additional supplementary question.
Mr Speaker, I also listened carefully to the answer, and the Minister spoke about health targets in general and people making comments about health targets, not the specific target.
I've heard the point. I've invited the member to ask an additional supplementary question. That is the way forward. The Honourable Annette King.
Thank you, Mr Speaker. On what date was the Ministry of Health first made aware of data manipulation of the 6-hour emergency department target by district health boards? On what date?
Yep.
The Honourable Dr Jonathan Coleman.
Speaker, I reject the central premise of that question, but as I said in my opening answer, people have been raising issues around the health targets, including the ED target, on and off for 7 years. But the fact is, the ED target has saved 700 lives per year and reduced crowding in ED by 50% across our hospitals, and that is a major achievement.
That's what
Supplementary question.
Supplementary question,
Order.
Mr Speaker.
Supplementary question, the Honourable Annette King.
If he has been assured of the integrity of the health targets and that they are sound, as he has claimed publicly, why is he asking officials to investigate?
The Honourable Dr Jonathan Coleman.
Oh, well, whenever Mrs King raises an allegation, I've found it pays to go and check it. That's why.
Order. I'll hear.
Point of order, Mr
Order.
Speaker.
Point of order, the
Point of
Honourable.
order, Mr Speaker. I did not raise this issue. It was raised by research by Dr Jones. So to say I raised it is completely wrong and not telling the truth.
But that now becomes a debating matter, not a point of order. I invite the member to continue with the supplementary questions.
Supplementary question,
Supplementary
Mr Speaker.
question, the Honourable Annette King.
Does he disagree with Dr Jones' finding that data manipulation occurs mostly in sites that were inadequately resourced to match the pressure put on staff in DHBs to meet his target?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, I don't think Dr Jones has said that. I mean, I can quote you here what Dr Jones has said. He said the length of time people stay in hospitals across the country has reduced on average by about 7 hours since the target was first introduced. He said that, open quotes, emergency department stays for all patients have reduced by over an hour, and for patients needing admission to hospital by about 3 hours. He said that where I work at Auckland City Hospital, the average time it takes for patients to get to the ward from the ED once the decision to admit them to hospital has been made has reduced significantly from 8 hours to 1.5 hours. And then it goes on to say, he says this direct quote, "We found the introduction of the 6-hour target was associated with a substantial 50% reduction in the number of patient deaths in emergency departments. That's about 700 fewer deaths than predicted. This result mirrors the 50% reduction in emergency departments crowding." And I can tell the member, I was a house surgeon with Peter Jones. I know him well, and he is a big fan of this target, a big supporter of it. He said when it first came in, he was initially sceptical, but now he says it's one of the best things the government's done for EDs.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette.
Who has directed Waikato District Health Boards to shuffle resources around to focus on first specialist assessment at the expense of follow-up appointments and elective surgery, leading to fewer elective hip and knee surgeries, with 831 performed in 2015-16 compared to 966 the year before?
The Honourable Dr. Jonathan.
Well, look, what I can tell that member is actually Waikato has performed extremely well on elective surgery over time. There's been more and more money go into that particular DHB, and the idea that Waikato is not producing more appointments and more operations and better access to services for people in the Waikato DHB catchment area is completely incorrect.
Point of order, Mr. Speaker.
Point of order, the Honourable
I seek leave to table an OAA dated the 25th of November 2016 for Waikato District Health Board, showing they did fewer hip and knee elective discharges in 2015-16 compared to the year before, as I said in my question.
Order, the last part's unnecessary. Leave us sought to table that particular OIA response. Is there any objection to it being tabled? There is none. Can be tabled.
Supplementary question.
Oh, point order.
I seek leave to table the increase in Waikato's elective surgical discharges, also in their hip and knee discharges, progressively over the last 8 years.
Leave us sought.
Point of order, Mr. Speaker.
Well, I need to put the leave. There's a member.
No, I'm not denying that. No.
Okay, let me put the leave first. We'll tidy that. Leave us sought to table that information of output by Waikato District Health Board. Is there any objection to that being tabled? There is none. It can be tabled.
Point of order, Mr. Speaker.
Point of order, the Honourable Annette.
The document that I'm tabling goes back to 2002, right up to 2015-16. So, in fact, when giving approval for me to table it, I would already be tabling what the Minister wants to table.
Order. When the member sought leave to table her document, she was quite specifically compared 15-16 with the year previously. And that's the information that I put to the House, and it decided to table that information. Further supplementary question, the Honourable Annette King.
Is he saying that Orthopaedic Clinical Director Stuart Hardy was not telling the truth when he told management of Waikato District Health Board that, quote, "My other concern is that individual surgeons are now being approached to cancel their operating lists to do first specialist assessments," end of quote?
The Honourable Dr. Jonathan Coleman.
Unlike the member, I don't go around accusing other people of not telling the truth.
Order. Question number 5.